Hi everyone, it's Leanne again. I got a question from a doula about the challenges of when a mom has a large breast, a large full breast, and a baby has a small mouth and they can't quite get connected. I always say that breastfeeding is sort of a puzzle. There's two major puzzle pieces: the milk supply and the baby that can latch on. So if you've got the milk and you've got the baby and you bring them together, that is successful breastfeeding. So when you have this extra challenge, what do you do? Well, one thing that I've noticed that can be helpful is if you have a breast. I always say the breast is sort of like a clock. You know, the hands around the clock, and a lot of moms will, as they're holding their baby, they'll kind of take their breast and hold it like this. Well, what I've noticed is that's a challenge, particularly for those babies with a small mouth and a large breast, because when you eat a sandwich, you take a bite this way. You don't turn it this way, right? So when a mom is holding the baby towards her, across her, and she's making this little pinch here, that is making it even more challenging. So I encourage the mom to kind of come up under the breast and just sort of narrow the breast at 3 and 9 o'clock. This helps the baby to be able to get latched on as the baby comes towards the mom in this position. So not always works, but it can be incredibly effective. Another tool that I like to use, it's called a nipple shield. This is a little silicone sombrero shaped gadget here. It's nice and soft. It's got some holes in it so that when it's placed onto the breast and the baby is nursing at the breast with the nipple shield, milk is coming through. So you'll notice that this one is sort of asymmetrical. This little area is so that when the baby's latched on and the nose may make contact, the contact is with the mother's breast and not with the silicone. So anyway, this one can be a nice tool. A couple of things to bear in mind. You want to make sure that the baby is actually getting milk out, and you would know that by pre and post weight checks with a digital scale that is accurate, not just your bathroom scale or the scale that you bought for $50 that you got on your baby registry. It's got to be a really accurate scale. You want to make sure that the baby continues to grow, that the milk supply continues to stay there, and know that these things are temporary. A newborn baby grows. All the challenges of nursing in the early days and weeks changes. That's why you see moms and babies out with like chubby 3, 4, 5-month-old babies nursing so easily. Talk to them, ask them, did they have an easy time in the beginning? I betcha most of them did not. So anyway, keep your questions coming, and I look forward to hearing from you. Take care. Bye.